I'm State Representative Sheila Solon. I represent Blue Springs, which is in the Kansas City area. I actually have a little bit of Lee Summit too. And I'm going to talk about a bill that I have been working on. This is the third year that I have filed oral parity legislation. And what it would do would require that insurance providers that cover intravenous chemotherapy treatments also cover the oral alternative to it. And this is something that is very important to the people of Missouri and also to my constituents. People who are fighting cancer just want to live normal lives. And we want to make sure and put the decisions regarding treatment in the hands of the patients and the doctors and not the insurance companies. The problem stems from the fact that that the pharmaceutical companies and research has kind of gotten ahead of the times. 25 to 30% of all new treatments are in the pill version and oral. And the insurance companies, you know, are still tied to many times the traditional IV treatment, which is a needle in your arm, a trip to the hospital. A lot of times, many times, the oral treatment has less side effects. Patients don't lose their hair. They don't get sick. The advantages also would be you could take the pill on a Friday and recover from any side effects and go back to work on Monday. The average time lost by a patient who is getting the traditional IV treatment is 26 days. And that's not taking into account I know my mom is a cancer survivor, and my sister and I would go with her to her treatment. So a lot of times family members are taking off from work to take their loved ones to the treatments. We also have many of our patients who live in rural areas, and the time that it takes to travel all the way to a hospital to get a treatment sometimes can be very troublesome, and they're going to have to take time off from their jobs. And you know, the biggest thing is too just the psychological benefits of being able to be in your own home to get a treatment as opposed to going to a hospital and a medical facility and have a needle put in your arm. And patients who are on Medicaid already are covered. The decisions are made by their oncologist on what treatment is best. The problem lies with the insurance companies and that they categorize the IV treatments as a medical procedure and the oral as a pharmaceutical. So many times when the oral is prescribed, there's thousands of dollars out of pocket. So the patient has to either do the IV treatment or forego treatment at all. 10% of patients, if they're prescribed the oral treatment and the out-of-pocket is high, they never get any treatment at all. We have an interim committee that studied this issue, and also that we have an actuarial study done. We met over the interim, and the actuarial study showed, as in 27 other states that have passed this legislation, that any increase in premiums would be very small, if at all. So hopefully that's good news, and hopefully it takes some of the objections away from the insurance industry. They just need to keep up with the times, and this is really a revolutionary new way that we will be treating cancer in the future, and it's something that we need to do here in Missouri, as other states have done, to help people who are battling cancer to have everything in their power to fight this terrible disease and to hopefully still be able to lead productive lives and be able to support their families.